Hi, everybody. Good afternoon. We'll go through the data and a couple other updates and then just take some questions. Unfortunately, we've had a tough day. We lost 4 residents of the community in hospitals over the last 24 hours. Asian female in her 60s, Caucasian male in his 70s, Caucasian male in his 60s, and a male who did not identify himself, 51 years of age. So certainly tough day. Thinking about their families and the families of those that have lost loved ones in this pandemic. We've lost 664 residents of the county in this pandemic. So it's been a tough year, and that's tough news. On the case front, things are better. Our 7-day average is below 1%, 0.9%. Really remarkable progress there. Overall, we've had 31,295 positive cases. That's up 54, so 54 new cases today. Certainly Thursday, Friday, Saturday tends to be the day where we get the most tests back. Therefore, your higher probability of having larger case days. We'll take 54. Only 1 case from senior facilities, so that's very good news. Right now, our senior facilities are about 12% of our hospitalizations, and we'll get into that number in a minute. In the peak of the second wave, that number was about 35%. So the vaccinations have had a huge impact related to that for sure. We have 66 people in the hospital now related to COVID-19. That's down again. And we have 9 of our neighbors in the ICU room. That number is down again, unfortunately, because we've lost some members of the community. But 9 is the lowest it's been in a while. Certainly, please keep these people in your thoughts and prayers. They're having a hard time. We need them to get well. And so please do what you can. Related to the vaccine, today we did and administered 1,100 new vaccines here today, first vaccines for a clinic. Tomorrow, we will be doing a pop-up clinic at the East Fayette Street Boys and Girls Club, working with community partners, targeting hard-to-reach communities, specifically our minority communities. The data shows, and it's starting to trend very clearly, that the mass vaccination sites at the fairgrounds and even our site here at the On Center is not seeing the type of participation in the zip codes in our minority communities. We know method of distribution at this point is important for us to get access to all members of the community. We're watching zip code data. This is our rural communities are doing better at getting to the mass vaccination sites and the pharmacies than a lot of our city neighborhoods are, but not as well as some of our other suburban neighborhoods. So we're watching this. Again, intentionally, our pod of what our county health department vaccinates, our rates of vaccinating specifically our minority and New American communities are higher than the overall regional rates. So this is something that I actually talked about quite a bit yesterday in testimony to the Homeland Security Committee. We are best suited to get to these communities because of our partnerships. And so tomorrow, 500 community members. The Credible Messenger strategy is what we once again implemented. I want to thank the following groups: Peace Incorporated, Housing Visions, Catholic Charities, Bethany Baptist Church, the Westcott Community Center, the Boys and Girls Club again for hosting over on the east side this time, Allen Foundation, First Student, United University Methodist Church, People's AME Zion Church, East Fayette Biddy Basketball, and our partners at the City of Syracuse, Mayor Walsh, Deputy Mayor Owens. Thank you for your leadership on this. Collectively, we're reaching out through credible messenger networks to get to communities that have not been vaccinating at the rates we want them to. So we're happy about that. On Monday, we will conclude this week's vaccination process. Normally, we would be done tomorrow. We get vaccine Tuesday. We're usually done 2-3 days. But because our vaccine was delayed, it pushes into Monday. Remember, vaccine week is a Tuesday to Tuesday situation anyways. Really a Wednesday to Wednesday. We get the vaccine usually on Tuesdays. So on Monday, again, we're working intentionally to vaccinate our members of the community with developmental disabilities, specifically, again, targeting our educators and those members of the community with comorbidities. So we're being very surgical to get to our vulnerable, to continue to work to get all of our educators vaccinated quickly. We're making tremendous progress there. And so that's what Monday's clinic will be. We will then get new vaccine in on Tuesday, and we will probably have a 2-day vaccination schedule next week, but there will be more to come on Monday when we know what our supply should be. Our supply should be at least 1,800 doses of vaccine. That's what we've been told we can count on. This week, we got the 1,800 plus the 500 for a pop-up clinic. We are working. The question was raised, I think, in the media to the state related to the FEMA sites coming in to communities. Part of what the FEMA sites do, it's a mass vaccination site. It brings in supply from the federal government. Those sites, we already have 2 mass vaccination sites. So we don't need another mass vaccination site. We have the fairgrounds, which is a lot of supply, a lot of new appointments. We have the on-center, which is, quite frankly, underutilized right now. So we don't need another mass vaccination site. We need more supply to utilize our existing infrastructure. But what we're talking to the state about is ways to continue to get into the hard-to-reach communities, give us the supply. We'll have dedicated streams to do that. So there'll be more to come on that. For us, it's about supply. We don't need more sites. We don't need more cooks in the kitchen. Give us the supply. Let us run. Let us do our job. Looking at testing, this is how we're going to open up our economy, continue to make the case about rebalancing everything COVID world related to restrictions, because this gives us data. And it gives us data, but it also finds pockets of the virus that may be lurking in our community. So a reminder, anybody symptomatic with COVID symptoms, we know what they are. I call on you to please, please, please get a test, rule out COVID-19, ongov.net/Cayuga Medical, Monday through Friday at the regional market at the F-Shed, 9 a.m. to 1 p.m. You can get a test. So please, 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 any symptoms, rule out COVID. Weekend symptomatic testing at Essentia Health, 8 to noon, 1050 West Genesee Street. Again, same link to get an appointment, ongov.net/Cayuga Medical. Our asymptomatic program is one that, again, we believe has really helped us find these caseloads and has driven our data. If you look at where we are at 0.9, the best positive rate out of any big county in New York State, we're trending much lower than New York State's average. Part of it is the testing strategy. We don't think finding a positive is a bad thing. We think it's actually a good thing. So we're testing asymptomatically in our schools. We are testing at times in assisted living facilities. We are testing in every corner of the county, and then we have essentially ongoing testing here at the On-Center, all with the sole intent to find that one case so it doesn't become 2, 3, 4, or 5 cases. So please take advantage of this. It's a rapid test. It's an antigen test, covid19.ongov.net. I think today we are at, today's what, Thursday? Yes. We are at the Onondaga Town Hall today, And then tomorrow we'll be at the Lafayette Community Center. But in addition to that, we've been testing in the schools all week. I'm very happy. I'm going to knock on wood. But in the schools this week, we've done probably almost 2,000 tests. This is coming back from break. I'm making some assumptions here, but I think my assumptions are probably correct, that there were folks that left the region for break and came back. We have not had a single positive in the schools this week. So again, we know that schools, the transmission isn't occurring in schools from the data, from the quarantine data that we've seen. But in addition to that, it looks really good, the fact that people aren't even asymptomatically getting into the buildings with the virus right now. So I think that's an important point. Update on where we are when we talked about the landlord survey last week or 2 weeks ago. I'm losing a little track of time. But we received money from the previous stimulus package to help renters and landlords impacted by COVID. And so we wanted to understand how big of a problem do we have here in Onondaga County. We asked people to participate in a survey, landlords, so we can get an idea of A, how many units do you own, B, how much rent are you owed to date. We had 1,100 landlords participate. They represent 14,000 units of housing. These landlords are owed $44 million. So we have $13 million. So this is good data. We now will go and try to curtail a program that helps address this issue. But it just shows you kind of the impact of this virus. I know it was reported about the sales tax in restaurants, how we got less sales tax because there was hundreds of millions of dollars of less sales. It's as we're getting through the vaccination process in our community, the reality is there will be a next phase of recovery where we have to address the other victims of this pandemic and focus in on them. One last thing before I take questions, I just want to thank the community. I shared a little bit about my personal situation and the struggles I'm having with my health, because one of the things I've learned in this pandemic, really recently too, focused in on more on it, is it's okay to be vulnerable, and it's okay to admit we've had a bad year, and there are many of us who have suffered much more than others, but we've all been impacted. And so hopefully people can take something from what I'm going through and my challenges and make sure that they take care of themselves, whether it's mental health, whether it's seeing your doctor. We've all been through a traumatic experience. I had to testify yesterday in front of the Homeland Security Committee in Congress, and I went through that experience at a macro level for 5 minutes, and it was traumatic just thinking about everything we've all been through. The good news is we've been through it together. So that's why I shared my story, and hopefully people can take something from that and make sure that they're taking care of themselves and their families. Saying that, I'll take questions.
Well, on that note, how are you feeling?
I feel okay. I feel physically, I feel I'm more rested. And so from that standpoint, I feel better. I still have, I have a vision impairment, and looks like it's getting a little bit better, but it's going to take a while. So that's just something, we're going to have to get through, and we will.
What's the journey look like for you? Do they, what they ruled out the worst case scenario.
Yeah.
They know what the problem is. What happens next?
Yeah, we continue to try to figure out what caused the nerve damage, right? And so we'll go through that, and I have great doctors, and they'll continue to work on that. And the rest helps, right? And so we'll because I can't drive, Andrew, you lose some of your freedom that way, and so I'm getting some more rest. And the vision's a little bit better. It was harder for me to be here 3 weeks ago than it is today.
You mentioned too many cooks in the kitchen is your fear. Is that a specific fear? Do you think that other governments will bring too many vaccine clinics to Onondaga County?
The reason why I said that in this context is because it seemed that there's a level of frustration that we didn't get a FEMA site. And sites aren't the challenge right now. It's just supply. So what's more beneficial to us is if you have 6,000 doses of vaccine a day to spare, give us the vaccine. And so, because we have people that can administer it. They're already on the payroll. You don't need to hire them. You don't need to bring in the National Guard to do it. Now, if you had a situation, Andrew, where the federal government said, Onondaga County, we can provide 200,000 vaccine doses next week, I would say bring it on. Everybody needs to get engaged, right? But right now, the infrastructure that exists is not being utilized to the full capacity. So until that happens, bringing on more distribution creates another channel for registration, more confusion. So we really need to utilize the existing infrastructure, recognizing other levels of government want to get engaged. They want to help. They feel the need. Sometimes helping is getting the resources to the people on the ground, and we haven't done a good enough job yet doing that.
Brian, you talked about rapid testing being the key to reopening or testing general.
Yeah.
With the rapid testing, how many are we doing a day here, and what do we have the capacity to do?
Yeah, so we're probably doing right now, I think we did 1,300 of them yesterday, collectively. We have been working and getting a lot of these through the state. At some point that runs out, but how procurement of testing worked before in the beginning of the pandemic, I could not buy tests myself as a local government. Think about that. A local government, the health department, you need to find COVID, you can't even buy it, right? That's where we were with the supply chain. That's changing, right? So now I have people actively coming to us saying, here's my test, will you buy it? We couldn't find tests to buy for a while. So the federal government has provided the state government with a lot of testing dollars and a lot of test kits, essentially. So we'll utilize those until they're gone. And then we'll continue to, as long as this virus is prevalent, and this is where we are until we get to that herd immunity. If we run into a shortage of them, we'll buy them ourselves.
Is there enough out there that you can have pretty much as many as you?
Yeah, interesting. So one of the things that came out this yesterday, I think there was some guidance related to weddings where you can all get the rapid test. So if you have a Saturday or Sunday, or maybe a Friday, Saturday for a wedding, I can see there being a challenge if you have 20 wedding parties with 150 people all trying to get tested, right? So I think I'm interested to see the last stimulus package, the state received money for testing. I don't know if they physically have received it yet, but they got appropriated money. We heard the governor talking about rapid testing sites. I'm assuming he's referencing that because of this funding that will be available. So certainly we believe our community deserves the fair share. Certainly until we can get through this herd immunity where these regulations are still in place, we would have the on-center available for people to do it, continue to utilize our Article 28 so that the economy can reopen there. But that could become a little bit of a challenge with supply. We're already having conversations with the state to try to see how that's all going to play out.
The Syracuse Teachers Union sent out a press release saying that they've talked and they're not quite comfortable with the 3 feet instead of 6 feet, and that they're going to be doing some meetings about it to maybe study it a little more. What do you think about that?
I've spoken to union leaders, and I appreciate concerns. I've also been very transparent that the public health experts in this community are the people working at the health department. And so if we're going to use public health and want to look at the data. They're the ones who analyze the data and have made great decisions. I appreciate their concerns. And so here's how this all works, right? So local school districts determine their reopening plans. Local school districts, when they started to make these plans, had the option back before school started to have desks at 3 feet apart with partitions. They had that option. They did not take that option because, remember the context then, the thought process was the students would not wear masks, so then they needed to be 6 feet apart. So what have we learned? We've learned that the students are better at wearing masks than the adults. Fact. So the desks then are 6 feet apart. We see things happening in the community. We work with the districts to make sure everybody's wearing masks regardless. Okay? So the plans are done, though. They take their plans, they go through a process with their parents, with their workforce, and then they go to the county health department for consultation on it, and we review those plans. What we're talking about now is looking at the data and now amending plans. So what does that require? It's still a local school district decision if they're going to amend their plan. But you cannot ease restrictions on a plan without our consultation from the health department. So Dr. Gupta is reviewing it, and she's reviewing it, the data. We know what the data is, right? We have under 600 active cases. There's towns that have under 5 cases. So you're saying in that town that has under 5 cases, a kid who is screened for COVID going into buildings for COVID symptoms, and then we're doing testing, and as we're building up herd immunity, and when the workforce has been almost vaccinated, that it's unsafe for that child to be in school an additional 6, 12 hours a week. I just don't think that's a strong argument. Dr. Gupta's team will look at the data. But what will happen then? Says, hey, we think 3 feet with a partition's okay. Okay? The school districts then make the call, right? That's their decision. We've just set forward guidance based off of the data and the best interests of this community for public health. What you cannot ignore at this point of this pandemic is the impacts that are happening to kids and parents with mental health, with overdoses, with suicide rates, with child abuse. We have to factor everything in now. And I understand if you represent a certain group, and that's your job is to represent that group, you look at it through that lens. We have to look at the whole picture now. And the risk that this pandemic has driven is much more than just the person who gets COVID positive at this point. The damage is tremendous. So I think overall, Monday, maybe Dr. Gupta will have an update for us. But I understand the concerns. Right now, the 6 feet, remember the 6 feet, it could have been 3 feet the whole time. It became 6 feet because everybody's saying the kids won't wear the masks. And they have worn the masks. And again, the districts are going to have to work with their workforce. But one of the things that we've been doing is we've been vaccinating educators and working with the unions. Get us everybody who hasn't gotten vaccinated or hasn't gotten an appointment. Now, we think we got everybody who didn't have an appointment. Now we'll talk about how many people have appointments in April, right? And how many people in your workforce there. And maybe we get them in earlier to help address some of these fears.
Do you have any data of how many teacher staff members have been vaccinated in the county, or?
I know that from our pod we would only have. I know going into this week we were over 2,100 educators at our pod. And I know this week between today, and Monday, we'll have about 500 educators vaccinated.
Have you been in touch with any of the charter schools? Because I know that some of them have been doing the 3 feet and they've been open. And have you been in touch with them to talk about maybe their plans and?
Yeah. So the plans. So I think again, this is my opinion now right here, but the most effective rules related to schools, in my opinion, why we've had so much success is the mask wearing and the fact that we have symptoms, screening for symptoms. We have people that can come down with something that where it's pretty obvious it's not COVID, but it's one of those symptoms, they get sent home, right? You have to do the, I have children. I go through this process every day. There's temperature checks. You have to attest that your children don't have symptoms. This has worked, right? So sick people aren't getting in the building, and then you're doing the testing. And we know through the data from quarantines specifically that it's not spreading in the building. The data is there. Anybody can say any argument you want. If there was evidence that through the quarantines that it was spreading in the building, Dr. Gupta never would have modified the quarantines. So because we've taken a data-driven approach, this whole pandemic to decision-making, at times we have to rebalance the teeter-totter. And whenever we do that, there's always anxiety. And it's going to happen at some point again where the data is going to say, it looks like we have vaccinated so many people. It looks like we're seeing this herd immunity. Positive rates are very, very, very low, even lower than where they are today. At some point, they will be. And then people will be saying, we need to remove this economic restriction or that. And the answer is, maybe we do. But that will make people anxious. So it's finding our balance as a community, recognizing all the impacts. And in this case, we are going to give public health guidance to districts. And I don't know what Dr. Gupta is going to come up with. She'll come up with it, and she'll explain her reasoning. And then the district then has a decision to make if they can actually go and implement the changes that may be possible.
I know you'll let Dr. Gupta step in and stop you if something is not data-backed. Would you like to see it reduced to 3 feet? Is that something you'd like to see if the data supports it?
So the only thing that's why this is really a topic, right, is because this is what some districts are saying is preventing them from more in-person learning. So I want to see more in-person learning, 100%. And some of the districts have already started that. Some are saying, I can't do it unless this regulation changes. Some will say, I need this regulation and this to change. So there's not a one-size-fits-all approach. I want to see more in-person learning because we are dealing with the consequences across many different lanes here. And we're really very close to vaccinating this entire class of professional workers within our education system.
And was that the catalyst you said to the superintendents? What can we try to get more kids in more days in a row? And they said, we need to fit more kids in the classroom, therefore we need fewer feet between desks.
Superintendents actually reached out to us saying, if you can go from this feet to 6 feet to 3 feet or 6 feet to 4 feet, that we can actually do more learning. And then we have the discussion, what's to change your plan? What's the process? It's been a long time, right? The guidance was right there in front of us. We asked for clarification. A week in COVID world is like 6 months. So it's been a long time since we've had this discussion. So we got clarification on what the proper roles were by everybody. And now, obviously, we're talking about easing some of the restrictions that the districts put in place, even though it's clear in the guidance they can do it. But they need our sign-off on it because you're going backwards, essentially.
What's Dr. Gupta telling you about variants of the virus and how that might reverse this very improving picture?
Yeah, I think right now we had some variants, right? So we had a couple UK variants. They were, I think, 30 days ago or so. We haven't seen a lot of variants here. So normally you don't know a lot about variants, right? So they get a lot of discussion. I know that where our data's gone over the last 30 days, so I don't think we've been impacted. And the longer we don't get impacted, and the more vaccinations that take place this week, by the end of this week, we'll have 90,000 people vaccinated for a first shot. And so 360,000 people essentially who are over 18 in the community. So tremendous progress is being made. So the more people you vaccinate, you're racing against. And again, we don't know what we don't know with the variants, but we know that most of the vaccines perform well against the variants that we are out there right now.
Do you feel that the teachers' unions, perhaps, every time they ask for something and it's granted, they then ask for a little bit more or a little more risk adverse than they were a little while ago, every time it seems to advance?
Yeah, I had a great conversation with a lot of the union leaders, and I understand their anxieties, and there's certain challenges that are unique to their buildings that have to be addressed. So I respect their positions, and I think most of the union leaders want to see in-person learning too. They have concerns. I understand it. It's their job to have concerns. They have a constituency. So I respect their position. We have a macro level management of the pandemic that we have to look at all the factors and look where all the weaknesses across the community. And right now our kids are suffering, and they're suffering badly. And there's science that's pointing to why this is happening, and doctors aren't disagreeing on this. So the question is, when is it safe to have the discussion to take a look at this? The data is the data, 0.9 7-day average. We weren't talking about this when our 7-day average was 8.6. So let's let the data tell the true picture, and that's what we've been doing this whole pandemic.
I've heard from some people concerns that the comorbidity eligibility is perhaps being abused, that people are using an old diagnosis because they haven't seen their doctor frequently, that, maybe it's not fraud, but it's certainly using outdated health status in a new context to benefit. Have you heard of similar concerns?
Well, we share concerns, and we knew when this eligibility came with the long list of eligible conditions that it does make it extremely hard to regulate. And then when it's hard to regulate, that's when you see levels of, to your point, I don't know if you would call it fraud or abuse, but unintended timing maybe. And it's something we're not going to be able to govern. That's the reality. We ask people to use their best judgment and sense of ethics to realize that for us to crush the bad outcomes with this virus, with hospitalizations and ICU stays and death, we have to get to the people that we know will have a bad outcome. We know this. We know that if you have certain comorbidities, or if you're a senior citizen and you get this, you're going to have a hard time. So we have to, getting them first is the ethical thing to do. It's the moral thing to do. And that's what, where we've had discretion, we have pushed for those things.
Ryan, we've talked a lot about potentially Monday being a date for students in the Carrier Dome. It's getting very tight, and we haven't heard of a plan.
Is Monday North Carolina, or is it? Oh, man. All
Do you
right.
still expect that to happen, or have we hit a snag somewhere along the line?
I'll have to get an update on that. I would love to make that happen. So on my to-do list after this will be to try to figure out if there's something I can do to help make that happen.
My understanding is the state has to come in and approve the site. Does that require like a in-town visit, or just looking at a plan?
Yeah, I think they may have already been here for an on-site visit. I'm not sure where that is in the process, but certainly we want to help get some students in the game, have that college experience. It'd be nice for the players to have that level of energy and enthusiasm. And quite frankly, I think we're going to need to win that game. So any home court advantage we can help provide to the home team, we're going to do that. So I'll follow up with SU on to see kind of exactly where we are on that.
Would you do that right now? Do you want to get your cell phone and call the chancellor at the briefing?
I would never want to put the chancellor on the spot like that. These are complicated things that have to get done. So, but certainly we got to win that game. So if we can get some people in there to help out our team, we want to do that.
Next time you hold a presser, it's going to be March. kind of your feeling from last March to this March. What's the difference now, and how are you feeling about it?
Yeah, it's incredible, and I think one of the things that, if you remember last March when this all started, and it feels like a decade ago, right? It just feels so long ago. We didn't know how long this would go on. We didn't know. We saw how fast and how damaging this was impacting the rest of the world, and so you prepare for the worst case scenarios, and so you're planning. We were planning before this. We were planning when we started to see it in China and in Europe, but there's a difference between planning and then preparing. And so then we were preparing, then we started mitigating. Then we had our case, and then the response started. Then the response became very complicated and very intense. And then you had kind of your lull, and your restart becomes the focus of how you get your economy going, deal with the economic damage. And then we kind of went through that, and then we had our second wave. And in the process, the vaccination starts. So it's amazing that this all happened within 12 months. It really is. So it's like I said before, it's traumatic to think back through all this, but how much as a community we've accomplished in the face of the 100-year pandemic. I think people should be proud, and I think we're going to get through this, and we're going to get through it sooner than people think. I have great faith that we're going to get more vaccine supply in the next 4 to 6 weeks. And when we do, our commitment is we will do everything we can to get this in people's arms fast, and so that we end this phase of this pandemic, because there's still more work to do when we're done vaccinating. Anything else?